Good morning, everybody. We are live with our beautiful patient, Jennifer, who did a revision brow lift, endoscopic approach brow lift, deep plane face and neck lift, upper lip lift, and she did it during our Facelift Master Course 6 months ago, so she's 6 months now after, and I want to show you how good she looks and what somebody looks like at 6 months. So first off, how you feeling?
I feel great.
Yeah?
Yeah.
So what do you think the whole experience has been so far?
Oh, it was so worth it. Minimal pain, minimal downtime.
And now you said, what were you saying earlier? You said you forgot even what you looked
I
like.
forgot what I look like. I have to look at the old pictures to remember what I look like because I look so great and so young now.
So you had a brow lift first.
I did.
Like a year or two before we did you, right?
Yes, about a year before you did.
Okay. And then you said it didn't really lift that much,
It didn't lift anything.
So look at this, guys. The brows have to go back where they need to go. They don't have to go up high. You don't want to really pull them this way because then people look weird and surprised. So see how it's holding up well. Here it was a little lower. And I'm going to try to show you the incisions because people talk about the incisions being seen and stuff. You just literally cannot see where we made the incision. Now this is from her old brow lift incision, and I cut out most of it, but this is from the old incision. And then if you look at the facelift incisions, let's get really close, and you cannot really see anything. So you want to make sure that there's no incisions that are visible. And then the neck, show the neck, Gabney. Look how nice her neck is compared to these, the jowls and the loose skin that she had. And let me back up so you guys can see that. Can you tuck your chin down? Okay. Let's kind of go over this way. Let's look at it this way now. Let me back up so you guys can see. This is a little bit of jowling. This is a little bit about heavy skin. If you look back here, there's just not much skin to grab. She's got a nice long neck. Look at these marionette lines. Look at the whole face seems to just be a little heavy. Look at the position of her brow right here, and the position of her brows right there. I want you to look straight here, sweetheart. There we go. And then also little subtle things, but see how you can perceive this distance versus that distance because her distance of her upper lip has been shortened. People want to know how old you are.
I'm 52.
52. So somebody says, looks 20 years younger, fabulous work. Thank you so much. And this is the goal. If it's one question that we always get from whoever's listening is, am I going to look weird? Am I going to look operated on? Am I going to look like a freak? Are people going to notice? I would just want to look refreshed. So that's the one fear that people have. And I don't blame them because they want to know, am I going to get the Joker look? Where you have swoop lines here because people don't do the surgery right, or they don't do it as well as it could be done, in our opinion, meaning like a proper deep plane approach, releasing ligaments here, in this area, and in the neck. So now this muscle layer, which we call the SMAS and the platysma and the temporoparietal fascia, can be really repositioned nicely. So let's look at some of the other views. Somebody says endoscopic brow lift is the best thing I've done, says Ashley. Okay, so if you just look at this picture, look over here, like right here, there we go. You just look younger. This person next to you looked like she was a little sad and a little tired, okay? Now you have this glow to your face and it just looks like a younger version of that person over there. Again, if you want to get technical about it, you can look at this jowling. You can look at this jawline, see how nice her jawline is here. This marionette line is gone. This distance has been shortened just enough. And if you go really close, you see I'm trying to get as close as I can so you guys can see the lip lift scarring. You really can't discern too much. And then how about if you look at her here, you can't really see any stigmata of any kind of facelifting, and you really shouldn't be able to see that. But so incisions completely healed, you can't see them. And then if you look, she's got this nice shadow going all the way up compared to that, okay? And then tuck your chin down, okay? So if you guys can see the difference here, let me back up a little bit so you can see. And then even lower down on her neck, she had some extra skin. I mean, this is her voice box, this is her larynx, so you can't pull any more than this, but it looks normal, it looks nice, and I think we're just getting to where we want to get. This is only 6 months, and if you look, she's happy. She's 6 months out. I think it'll still get a little bit better, but I think you've kind of gone over the hump. Like the first week or 2 or 3, did you think like you looked totally different and you did more after,
I think you do go through a stage where you look a little awkward and a little weird, but that's just from the tightness, but then everything settles down.
Somebody says, how long does it take from beginning to end, including rehabilitation? Somebody else says, I love it. Thank you. So we tell people the first week you're, a little puffy, a little bruised here and there. And she did it, by the way, guys, with our Facelift Master Course. So all the doctors in attendance were watching, so we did videos, we did everything for her. So the first week you're a little bruised and swollen. Second week sutures are coming out. You're starting to settle in. Third week, I think you start kind of looking like yourself. And I think by 4th week, you were probably socially ready, but every month it gets better, doesn't it?
Yes. And really, it was only the first few days that I had a headache. But other than that, that was maybe the only, but nothing was really that painful.
Somebody says she looks like she's the daughter of the before. Somebody says, I had a forehead lift, but my brows still need a lift. Should I need that after a forehead lift? Probably not, Bonnie. I don't know what your doctor did or surgeon did, but we can be happy to talk to you about it. Somebody says, lovely transformation, beautiful. The scarring is not detectable. Wow. Yes, and that's the goal, guys. I play golf. Can you pull your hair back? Absolutely. Can you pull your hair back? Look at this, guys. Go play golf. Okay. And then let me see what else people have commented. Any pain after? You said she said her age already, guys. She's 52, right?
Yeah, 52.
52. That does kind of look like your older sister or mother, right?
Yes.
Can we do without general anesthesia? Yes. So Jennifer had what we call IV sedation or twilight anesthesia, the same thing that you get if you get a colonoscopy or an endoscopy. Is a brow lift, Cliff is asking, if a brow lift possible on a bald person, or is it not really possible? It absolutely is possible, Phil. Cliff. The scalp heals really well, and any part of your scalp that used to have hair on it heals super well. We do men all the time. We do bald men all the time. So you have to, make sure you know how to put those incisions in the right places. But yes, so the answer to your question is absolutely. Somebody says, is she going to do Botox for her forehead wrinkles? And she just did. You just did the Botox, right?
I just did the Botox.
And then somebody says, can you have rhinoplasty awake? Yes. She looks happier. Summer says you look happier. I think. Bellafit says 52. She looks 28.
Great.
You look great. So what else? What else can you tell anybody who's even thinking about doing this? Like, what was your decision-making, algorithm?
I didn't want to wait too long. I wanted to be able to enjoy it and feel better about myself. At that point, I would look in the mirror and I looked sad, I looked tired, and I didn't want to do it. And I didn't want to wait too long to do it because I wanted to enjoy it. I think a lot of people think when you have a facelift that you're going to look like a plastic or you're not going to look like yourself. And I think all my family was very pleasant surprise that I look just the same, just a little bit younger.
Nice.
I don't look any different. I just look younger.
What do people at work say?
Oh, they think it's great.
Yeah.
No, best thing.
Very cool, very cool. So let's see if anybody else has any other questions. Otherwise, somebody says, so dang beautiful. Way to go, Jen. Let's see. Where are you located, guys? We are in New York City right now. And we also have offices in New Jersey, but right now we're in our Park Avenue office on 66th and Park Avenue. You look great. You're getting a lot of good for you. You look great. Enjoy your life. Any pain at all? No pain afterwards. And for everybody who's just tuning in, Jennifer 6 months ago during our Facelift Master Course had a revision brow lift where we repositioned her brows, deep plane face and neck lift, and an upper lip lift. She looks great. She's recovering nicely. She's getting good compliments. She's happy. That's the most important thing. And we think that she looks just like a better version of herself. And thank you for all your comments, guys. And then, we'll check in with you next time, Jennifer. So somebody says, what could we do for accommodations for somebody coming out of state? So we have a wellness center for everybody listening. You can stay there. You have your own suites. And then you also have nursing and hyperbaric oxygen, LED light, IV infusion, lymphatic drainage. So it's a complete center if you want to stay there and, you don't want to bring anybody here with you. So we take good care of you there. Any numbness in the face? That's actually a very good question.
I still just have a little, I don't even know if it's numbness, but tightness just around here, my ears and neck.
Okay.
But nothing bad. It seems like it's improving each time.
Bubbles LaRue says, wow, so beautiful, artiste. Thank you so much. Again, let's show these jaw lines, show these nice contours. You guys look at this jawline. Look at her there. Look at her here. Let me try to get it exactly even. There you go. You can see, follow this shadow. You see how it's wavy. There's jowling right there. She just looks more tired here. Look at the brows that are heavy. And she's still trying to keep these brows up. That's why she's had deep wrinkles, in her forehead, because you're trying to keep the forehead up. Beautiful jawline. Somebody says, how old is she? You guys checking in. She's 52. Any fat transfer was done. We did not do any fat transfer in her surgery, but it's a good idea to do it. She's starting to get a little hollow in her temples, so we may consider that. She's 20 years younger. Good job, doc. Beautiful. How old is she? She's 52. Doc, you're such an artist and have such a zeal to give people a new start to life. Thank you. Thank you so much. Stunner. So some Cliff is asking, is it practical to come from the UK for a deep plane facelift recovery in your wellness center? We would tell you absolutely, Phil. I mean, I don't know why I'm calling Cliff Phil. Cliff, because we get probably, 50 to 60% of our patients are from out of the country. So, Cliff, come on down. Did she have chin implant? No. Any CO2 laser done? In her case, no. But thanks for asking, because for most of our patients, after they do this whole full face rejuvenation, we do some fat transfer and we do laser resurfacing. What else? That's about it. Thank you so much. How long do you have to stay there if you come from another country? So we tell people, guys, if you can stay 7 to 10 days, it's great, because we can pull out all your sutures. You guys, look at all this. This was really, and she's holding her head up. When she puts her chin down, this got a lot worse. 7 to 10 days is kind of the magic time where we can take all your sutures out and, have you heal enough where you can get back on a plane and go. Do you do this kind of surgery if you're 30? Is it too young? I've been in an accident where I hit the head and I was in the hospital for 3 weeks and it's swollen. If you have the anatomical changes that need correcting, age really doesn't get that, age isn't that big of an issue, but you have to have something that we can actually reposition and fix for you. How is a deep plane facelift different from a traditional lift? So briefly, a deep plane facelift, we release ligaments all throughout the face, at the temporal crest, the orbital ligaments, zygomatical-cutaneous ligaments, cervical retaining ligaments, mesenteric ligaments, even maxillary ligaments. And then we elevate the muscle. Here it's the platysma, here it's the SMAS, here is the temporal parietal fascia, and we reposition that fully. So we elevate all the way to here and reposition that fully. Some other facelifts just do skin only, where they just pull on your skin a little bit, and some other ones just take a little bit of that muscle and just put a stitch in it. There's a whole discussion that we can tell you, like, this is your mobile SMAS, the part that moves. This is the fixed SMAS. So if you're doing anything to the SMAS out here, it doesn't do much. If you come over here and take a little bit out, that does a little bit more. But we like to do a composite elevation and lift. That's why they look so good and they last so long. Dr. Aaron Baba says, we're watching your content frequently and very like your procedures and your concept. Thank you so much, Doc. If you guys like, come to our course. The next one is April 24th to the 27th, 2025. Do you need to travel to the USA for a consultation, or can that be done remotely? Absolutely, Cliff. Do that remotely. We can talk to you. That way you can decide, and come up with a game plan. Do the cut ligaments grow back? That is a great, great question. Bellafit asked that. So some of them you don't really want to grow back, but then you do make new adhesions when the muscle is repositioned in the new area. So I don't know if those specific ligaments grow back, but they reattach at a different level. Any downsides to cutting those ligaments? So the Lisa asking that. So the current thinking, and if you can see the mechanics of this, and I'm coming out with some videos pretty soon, and if you guys can stomach it, we'll show you. If you don't release those ligaments or cut those ligaments, you're pulling this muscle against a gradient. So you can't, if it's not fully released, the muscle doesn't move. And if the muscle doesn't move, the facelift doesn't last. So once you release those retaining ligaments, then everything moves as one whole piece. And you have to see it in the operating room to be like really convinced and have your aha moment. Let's see. And that, I think, is all for now. How long does it, Jenny says, how long does it take to get an appointment? I think you can get an online appointment, meaning a virtual one, relatively quickly. What is the fat transfer take rate? The fat transfer take rate is pretty good. I have this special technique that I put it under the fascia and over the muscle. So I don't like the whole technique of coming in outside the skin and doing multiple jabs and stuff. So what we do is we go in through those deep spaces that we elevate during a facelift anyway and deposit our fat specifically in the areas that we like. Okay. Thank you for being such a champ.
Thank you.
Final words after 6 months.
Well, if anybody is thinking about doing it, go ahead, and Dr. Kassir, you're in great hands.
Thank you. Thank you so much. Thanks, everybody, for tuning in. And Jennifer, as always, we appreciate you.
Thank you.